To understand the vaccine debate, first you have to understand herd immunity.
Herd immunity is this concept that when enough people are immune to an illness, even if somebody from the outside were to expose that community to the illness, it's very unlikely that the illness would take root in the community.
But in order to reach herd immunity, you need a certain percentage of a population to be vaccinated. For example, to get herd immunity from the measles, you need 95% of a population to be vaccinated.
The problem is if the number of vaccinated individuals starts to go down, then you don't have that herd immunity, and then you can start to have outbreaks of an illness.
That's where the anti-vaccine movement comes into the picture, and it goes all the way back to a now debunked study from 1998, falsely linking the MMR vaccine to autism. Since then, misinformation about vaccines has been spreading across the internet like wildfire.
My hesitancy, honestly, just comes from researching.
Vanessa Schaefer joins a growing number of parents who choose not to vaccinate their kids. But hold on, you might be asking, doesn't Ohio law require parents vaccinate their kids in order to send them to school? Yes and no. There are two exemptions, one medical and two reasons of conscience, such as religious or other beliefs.
I chose the religious exemption because it is available to me.
Schaefer and other parents often justify their choices by saying their unvaccinated kids pose no risk to their classmates because everyone else already has their vaccines. That's where Dr. Edwards says they're wrong.
There are some people who have genuine medical reasons that don't allow them to get vaccinated.
That includes this little boy, Liam. Because he had cancer, his doctor said he couldn't receive some vaccines, like MMR or the flu shot.
When Liam was going through chemotherapy, and if he would have got a common cold, much less the flu or the measles or anything like that, it could have killed him.
And Liam's mom, Wendy, says those parents who choose not to vaccinate their kids for personal or religious beliefs put vulnerable children like her son at greater risk.
As scary as it can get to know that something very simple could take your child down in addition to what they're already facing.
While this discussion is at the forefront right now because of the COVID-19 vaccine, 3 News Investigates has uncovered that parents not wanting to vaccinate their kids has been an issue long before the pandemic began. I pulled the records, and I found in the 2008-2009 school year, 2,900 Ohio children were exempted from vaccines for religious or personal beliefs. 10 years later, that number jumped to 9,800 children, a 235% increase, or 1 in every 50 Ohio students not getting vaccinated.
Everybody has their own right to make decisions for their own children, but I want them to understand that their decisions directly affect anyone that they come in contact with.
Both the CDC and the World Health Organization say that vaccines prevent millions of deaths every year and could prevent millions more if only we could improve vaccination rates. For a closer look at my data and how I got it, head on over to our website, that's WKYC.com. Rachel Polansky, 3 News.